Hello friends, welcome you in Research Needs. In this video we will see different methods of anesthesia and euthanasia in laboratory animals by using Expharm software. So after clicking you will find this type of interface. In that we will click virtual practice. To start practicing, click here. So what is anesthesia? We will see first. Anesthesia is a state of controlled and temporary loss of sensation or awareness that is induced for medical or veterinary purposes. It may include some or all analgesia, paralysis, amnesia, and unconsciousness. An individual under the effect of anesthesia drug is referred to as being anesthetized. So this is the anesthesia. Now we will see what is euthanasia. Euthanasia is the practice of intensely ending life to elimination pain and suffering. So now we will see the theory part. Here in theory you can see the commonly used method of anesthesia and euthanasia. In that you will see the drugs, different drug which is generally used for anesthesia and euthanasia. So their doses are mentioned with animal species wise. So you can use that while you doing experiment. So here it is showing source CCSC government website, and there you can go and find this chart. So next we will go on practical. In anesthesia methods, there was shown two methods, inhalation and injection. We will see first inhalation. So inhalation anesthesia, in that we will see first theory part. Inhalation method. In this method, appropriate agent as mentioned in theory are inhaled by the animals as per the appropriate protocol as mentioned in theory. Already we have seen the chart. Here we will see now the video. Inhalation anesthesia. Here in video you can see here it has used glass funnel, and its upper means pipe like part is plugged with a cotton, and it has a cotton soaked with anesthesia. But in general practices we are using desiccators with cotton which is soaked with anesthesia. We will see the practice how they are doing that. Here it is plugged with cotton plug, glass funnel is used. So we will click on mice first. Now we will click cotton with anesthesia. We have to keep it inside the funnel. Now you can see the animal is anesthetized. So this practice we have to do. Now we will see next one. We will cut this. Next we will see the injection. Here it's showing only theory part. Injectable method. In this method, appropriate agent as mentioned in the theory sections are injected through appropriate routes. The technique for SC, subcutaneous, IM, intramuscular, IV, intravenous, and IP, intraperitoneal are already detailed in route of administration in sections. If you want video to see how to do doses for IV, subcutaneous, IM and IP, you can click on I button and see the video, or you will find the video link in description. Next we will see. So we have completed this anesthesia method. We will go for euthanasia methods. In that we will see first chemical method, inhalation. So theory part we will see. Inhalation method. In this method, appropriate agents as mentioned above are inhaled by animals as per appropriate protocol mentioned above. So here they have written nothing. We will go in directly practical. Here you will see it's a CO2 chamber, and this is CO2 cylinder. Here you can see gauze by which they are controlling the gas. So now we will click on mice, how they are operating. We will see. We have to pick this mice and keep inside the chamber. Now we will close the chamber. Now we have to click the cylinder. It has passed the gas. The animal is dead. So it is kind of painless killing. So that's why this method is used for euthanasia. Now we will see another method. By injection, we can directly give the dose to animals. For that, as per the body weight, we have to give the IP dose to the animals. So I will show you the video for that also. You can see the video here. After this IP dose, animals will get die because it's a overdose of anesthesia. So these kind of practices are being done for euthanasia. Now we will see next video. The physical methods. Cervical dislocation. In this theory part, cervical dislocation involves a dislocation of head part above the neck by stretching. We will see the practices. Now we will click. Here the head is gripped and the tail is pulled, and the animals, this part get break, and that's why animal get die. So cervical dislocation is done in rat and mice only. Next, decapitation. We will see the theory. It involves the action of cutting off head of animal. We will see the practices. Here we have to take scissor and directly we have to cut the neck of the animals. If you are doing this type of practice, you have to justify while you taking permission in CCSCA ISA meeting. If you have reason for that, then only they give you permission to do this type of experiment. Otherwise it is completely prohibited. Now we will see the examinations theory part. We will see in this method, first the animals are anesthetized by the suitable method. After that, large volume of blood is extracted. Drainage is done to kill the animals. So we will see the practices. Here first anesthetize the animals. After that do drain off blood from the animals using scalpel. So we will click on scalpel. So here you have to drain out all the blood from the animals. Animal will die. So this is the procedure, last procedure. These practices are ethical, and we can use this method in our experiment, but we have to take permission from IAC. So now these methods are not recommended by the CPCSE or committee. So we will see not commonly used, not recommended, not accepted method. Electrocutions. Electrocutions using electric shock has been used as a method to induce death. In this method, electric shock is given to animals to induce death. Electrocution induces death by cardiac fibrillations, which causes cerebral hypoxia. So we will see the practices. Directly we have to give the current to the animals. Animal will die. We will see the next one. penetration captive bolt. We will see the theory. Pitching is the design to cause death by the increasing the destruction of brainstem and the upper spinal cord tissue. It is performed by inserting pitching rod through and the entry site produced in the skull by the projectiles, bullet or bolt. We will see the practices. We have to click on screw machine. We will click on that. This is how animals are killed, but this practice is not recommended. So we will see the next one. Microwave irradiations. In theory, we will see microwave instruments have been specified, designed for use in euthanasia of laboratory mice and rats. We will see the practices. So here you can see the microwave irradiation instrument is there. We will click on mice. By here you can see now animal is euthanized. We will see the next one. Euthanasia by blow to the head, stunning. In this method, a heavy blow to the head of animals is applied. So we will see the practices. Here, click on the mice. Their head is blown to the table. Like this type of practices is now not recommended. We will see the next one. The thoracic cardiopulmonary cardiac compressions. Thoracic compression involves compressing the thoracic part of animals. Thoracic cardiopulmonary cardiac compression is used to kill animals when alternate techniques are not practical. So we will go and see the practices. So we have to keep the animals on stool and we have to press it hard. So this is how animals are killed by euthanasia, and these practices are not recommended nowadays. So we will go back. So how was the video? Please do comment. If you have any query, you can do comment. Please share this video to your colleague or friends. Thank you for watching Research Need. Thank you very much.